Hi everyone, my name is Dr. Gill and I'm a local Walsall-based GP.
And I'm Dr. Bagri, I'm also a local-based GP.
It's lovely to be able to welcome you all to your induction today. And today we thought we'll just share a few tips and tricks about how we can help each other with you guys supporting patients in the hospital and us guys supporting them in the community. So first of all, I think it's very important that we work really well together because ultimately that's how the patients will benefit the most. And a key area of communication line that we have is particularly the electronic discharge summaries that you kindly will be providing for us. So, Harunda, you've been a GP for a number of years in Walsall now. Are there any tips and tricks you can sort of tell us about how to write a good discharge summary?
Yeah, so I agree. I think a discharge letter is really key for both the patient, also us in general practice, and also secondary care. So it's about the level of detail is essential really that we need.
So not too much and not too little.
That's correct. So things that would really help us in general practice is a key diagnosis, a key investigations, the key test that will help us identify exactly what the patient has had and what the patient journey has been during that stay.
Yeah, no, absolutely. And particularly sometimes medications will change in the course of a hospital admission. So it's very important for us to know the rationale for the change in the medication and specifically, you know, what the dose is and what the plan is going forward. What about sort of in terms of investigations, because sometimes patients need to be discharged from the hospital.
Yeah.
What's the line around chasing investigations?
So generally, it should generally be the clinician who's doing the investigation, should be really chasing that. It's always the best way. So for example, any investigations that need to be done on discharge should really be better if it's already arranged. It helps really with the patient journey, so they don't have to make extra calls or contact with general practice. And if there's any problems, then ideally followed up by the specialist there, or that information communicated back to us in general practice so we're aware of what to do from the next step.
Absolutely. Like just picking an example, like flow test is a very important example, isn't it? So our gastroenterology consultants will do the test, chase up the results and communicate the results back to us.
Yeah.
So it's better sort of connected that way, and also it's in keeping with the GMC guidelines about each doctor chasing up their own referrals. What about referring to other consultants in the hospital?
Yeah. So this is a good question really. I think with referrals to different consultants, I think there's always a miscommunication in secondary care that it's frowned upon in primary care for patients to be referred to into specialities because they're worried that you're treading on someone's toes, which again is incorrect really. So as per the contract, all interspeciality referrals can be done from secondary care to relevant specialists, for example.
Absolutely. So when discharging a patient, if patient, for example, needs a cardiology review, rather than the patient having to come to the GP surgery and asking for that, and we will not have much of a clue as to why that referral is being requested unless it's very clearly written in the discharge summaries. It can be much more efficient for just to put the referral through before the patient has been discharged. And sometimes, I mean, I remember from my days in working in the hospital, we need to get the attention of the doctors in working in general practice.
Yeah.
What are the best ways to communicate with GPs in a working day?
I think it's we're always happy to speak to secondary colleagues. I think it always works better than a letter or a fax. So we don't mind if, say, for example, contacting us at the surgery, you need some information from us as a GP. You may not actually speak to one of us, it could be one of our team members, a pharmacist, social prescriber, lots of other people who work with us in general practice. But if there's a question or a query about it, you're not sure, then you can always contact surgery, leave a message. And obviously we can be quite busy, but we'll always often be happy to speak to colleagues about that. We always have time for that, if you agree as well.
Absolutely, absolutely. Ultimately, it's about looking after our patients the best that we can and supporting each other both in GP surgeries and in the hospitals. And so with that, I think we'll sign out and wish you guys all the best with your careers ahead.
Yeah. Again, I would like to thank you for all the time, and thank you for your continuing work during this pandemic. The main message I want to get is we're really happy to work with you guys in secondary care. The whole system's under extreme pressure, but I think this is a really good start so we can get that communication going, and we're happy to again work together again to get some more support out and hopefully bridge that gap between primary and secondary care. So thanks again for this time today.
Absolutely.